Thank you. Thank you. It's beautiful to have all these amazing technologies and knowledge available. We're going to invite all the presenters up for any questions and answers. I would like to share one thing about biochemistry that's the basis of all health function, and that is the pH of the body. And living in such a toxic world, both eating organically and or in living and having a great positive attitude, we still are bombarded by heavy metals which have the ability to then lodge in the body, turn the body from an alkaline entity, which is how the design of the Creator made our bodies. The blood is alkaline, the lymphatic fluid is alkaline, the fluid that bathes your brain and your spinal column, called cerebral spinal fluid, is alkaline. The fluid in every joint, called synovial fluid, is alkaline. The fluid behind your eyes, vitreous fluid, is alkaline. So we have an alkaline entity. The identification of the acidity through a heavy metal test and a thermogram is an essential fundamental to a new pathway of health, and it's irrefutable evidence of the kind of direction we all need to be going in. So with that said, I'd like to bring everyone up so that you can ask any questions you have, and I will make the microphone available to whoever wants to ask a question. Anyone have any questions? What a smart audience. Okay, go ahead.
Thank you. My question's of a personal nature, certainly posited to the professionals in front of us, but also to anyone in the room. I'm seeking a surgeon to remove a breast implant that has a cancer diagnosis. I believe that's related to the implant, and so far, oncology trumps plastic surgery. I need to get this implant out. So if anyone knows of an integral surgeon who will provide individual care, I welcome that. That's my question.
Well, I'll answer first, just because I have the great depth of experience there. It is not always necessary to remove an implant. That is number one. It does change health. It does change someone's life. Broken record, you need to get a thermogram first before you proceed in any single direction. You need to be strengthening your immune system before you go and do an explant. That is also very critical. And yes, we have doctors that we recommend in the Dallas Metroplex that have been doing it for a long time. Anyone else want to add anything to that?
I would like to add that I have been in your care, and the symptomatology associated with this ruptured medical device is reduced by 80%. So
awesome.
I know personally of the power of biology and loving, truthful regard. Professionals, dental, Dr. Engram's my dentist, MARTA, and I got a couple others to find now. Thank you.
Okay, so we will provide you with a source. Any other questions? Anybody?
Good afternoon. I first want to thank you all for sharing this scientific information with all of us. It was extremely educational for me. I have quite a few favorites in the room that spoke to me today, and I've gained some more, so I appreciate that. But my question is to you all, can you all share more information about the consumption of grains versus whole grains and how it's beneficial and how much to consume to address osteoporosis versus gut health?
Any takers?
Grains are human food. I'll just say that first. As much as it's been now vilified, it really isn't a bad thing. But of course, what has been done to the grains does matter. So we want, whenever we say whole grains, if it is not far removed from the source of the grain, that's a whole grain. If it is far removed from it in a form of bleaching, processing, dehulling, and all of those processes, then it's not whole anymore. So whole grains on our tongue, the first taste bud that we have is for sweetness. So grains, as well as starches, are all sweet in nature. And that's not by accident. Everything that is in us is a divine creation, and that's actually for a reason. So grains are wonderful to consume as long as they are closest to the way they are grown and not far from it. And often organic is better than non-organic just because of pesticides having arsenic in it. And so there's a lot of heavy metal poisoning that comes with all of that as well, and fertilizers too. And we can avoid all of that and eat it in that way. And whenever you asked about the quantity of eating grains, we always want to eat vegetables twice as much as you eat your starches. So the most nutrients are in the plants that grow closest to the soil. So leafy greens have the most nutrients. And then we have the other vegetables like okra, eggplants, and things like that. They have the next amount of vegetables. Then comes fruits and starches and grains. So if you eat larger quantities that are growing closest to the soil, then you get the most nutrient benefits without the calories that comes with it.
Okay, I know I'm the dentist, but I would say, and grains are so controversial from all the books that have come out, all the different diets, all the thing, and all the crap that we've done to grains over the last few decades. What I will say is that for me personally, I have a history of having an autoimmune condition. When I was heavily, intensely treating that autoimmune condition, I really needed to eliminate grains altogether for a time. Now, most of the time, for me personally, I do well with a little bit of quinoa, a little bit of brown rice on occasion. That's how I function best. So what I always tell patients is whether you're doing no grains, you're doing some grains, you're doing a ton of whole grains, is yes, quality is paramount, but individual care, I think, is the most important. So I think making sure you're working with a naturopath, a homeopath, somebody who is trained and on your team is really the best answer to find that magic balance for you.
This is a very large topic. Yes, so thank you for bringing that up. Yes. So I would also add, we evolved way, way, way long ago when we were hunter-gatherers, right? This is what our physiology has evolved to be. And then we really got away from that, you know? But if you think about it, when you're a hunter-gatherer, what are you doing? You're out hunting. Animals don't stand still very well, right? So it takes work to hunt. But also the gathering. So you might get a little bit of this and a little bit of that. A lot of greens, because a lot of those are available. A little bit of grains, right? So we were evolved to eat a lot of vegetables, a lot of greens, a little bit of grains. So if we get a little bit of that, for most people, that's okay. And the other thing that I would say is, in this country, our grains are very compromised. We have to be very aware of that. Our wheat fields are drenched with glyphosate in order to desiccate the grain so they can be harvested with machines. That's really important to be aware of. Even the organic wheat can be drenched with glyphosate to dry the wheat, and it doesn't have to be reported. So just to be aware of, be careful of the quality of your grains. But yeah, that's what I wanted to add.
Careful with it. How do you know if you're buying organic? That I mean, you think if you're buying organic,
It's easier to eliminate it.
Well, the key quantity of the question that you asked is the beauty of every doctor up here, because Deb's not a doctor, but each doctor here has studied kinesiology. And kinesiology is critical for any doctor that you're working with. Without that technique, they're guessing, and I don't like to guess. And having doctored 20,000 patients over my lifetime, I see the biochemical individuality and the uniqueness of each person's biochemistry is the first thing that you need to respect. And so it's interesting when we say something like this, but then we can take an example of taking someone who comes to your office and they're an Eskimo. How many grains are you going to give an Eskimo to eat? How many greens are you going to recommend for the Eskimo to eat when he's never eaten a green his whole life? So there's a lot of other factors as to where is your lineage from and how far removed are you from your lineage, or do you still have strong roots there in how you were raised and how you were, given nutrition in your growing years. So there's a lot of factors, but biochemical individuality is a huge key, and that's what we all specialize in, respecting that. And someone can come in and they need a lot of grains, and another person can come in and can't have any at all. So, for example, just this week, I had an example of 2 autistic children come in. And they were on, for their lineage, a very healthy diet that their culture fed them. And I told them that they needed to come off of everything that they're eating, because that's what was radically disturbing their whole microbiome of their digestive tract. And we see that individual checking through kinesiology is critical. It's just critical. Yes.
Okay, I have 2 questions. So, Dr. Engram, you've seen me for my bone loss in my tooth, and I was just curious if OsteoStrong has any benefit for bone growth in the mouth, or is that really not really something that helps with?
Skull is physiologically and metabolically a little different from the other skeletal bones. Now, interestingly enough, I had a very strong bodybuilder type individual doing OsteoStrong for a while, and he went to a place called DEXA-Fit, where they measured, BMI, fat, muscle, and total skeletal mass, and they would do it by skull, by complete skeletal strength, and in the more conventional areas. And he was doing OsteoStrong for about 6 months, and he showed increased bone mass in his skull. Now, the only thing that I can think, because there's nothing where you're applying pressure to your skull in OsteoStrong, unless you fall off of something, but there is evidence that if you are triggering osteogenesis locally, that there is a systemic effect within the entire musculoskeletal system.
The question is also, is it the bone loss only in your mouth?
I believe so, but I don't
Have you
have
ever
any.
had a,
No.
so that would be an interesting thing to look at, unless you are just having super acidic saliva, which is causing you to have a bone loss in your mouth. You could have a bone loss everywhere.
And it could just be circulatory, as she's mentioned. If you have interrupted blood flow, right, that's going to lead to that, and it might not be systemic, but if you look a little young to have already had a bone density scan, but it's never something to go ahead and do. If you have any bone loss anywhere, because sometimes it can be insidious and catch you by surprise.
Let's say yours was, your case was unusual for sure. And my inclination is that it's more inflammatory bacterial to that specific location would be my thought, but it's certainly a really cool concept to test out. So yeah, I would say maybe an echo light scan and doing a little osteostrong to see if there's any difference there would be a cool experiment to do.
Two things in that. One, very rarely will you have an infection in isolation. So not only would I encourage an oligoscan, but also a thermogram. Absolutely. And, you know, osteostrong is at the infancy of its existence. If we were 50 years from now, I would feel very confident that it will be revealed that osteostrong will change every bone in the human body. It will have no limitations whatsoever because of all the connectedness. We talked earlier about the connectedness of the teeth to every organ of the human body. Well, osteostrong, as Deb mentioned, does the spine. Well, as we mentioned earlier, the spine goes to every organ in the human body. So nothing operates in isolation in our bodies. We have been taught segmentalization. You go for the gallbladder, you go to a kidney doctor, you go to a liver doctor, you go to a gynecologist. But the beautiful part about what our belief system is that it's all connected. And the tool that connects everything is the thermogram. It'll connect dental, it'll connect bone health, it'll connect microbiome, it'll connect everything that you can get a good picture about.
And my second question is really just a curiosity, talking about how the teeth are related to different parts of your body. If you're missing a tooth, is there anything that you would be lacking, or I don't know how to ask that question, but I think you understand where I'm going with it.
I understand what you're saying, but it's more gum health than it is necessarily missing a tooth. So if the tooth that is missing has good gum health, then you're going to be fine, because the neurological communication from that tooth to that body organ is going to be in good shape. Yeah.
Yeah, that's a good question. And this comes up a lot in the office too, especially when we're having conversations around, do I get a root canal or do I pull the tooth? That's when one size does not fit all. So I'm not on board with my biological dental colleagues who say you should never ever have a root canal. I'm also, not on board with everything should get a root canal. I think there are risks to any option that you choose. So yes, if you get a root canals can have potential problems. There are all kinds of infections that are different than normal living tooth infections that can start when you have a root canal treatment. But also, if we lose a tooth, then we're losing part of our body. And then yes, you're disrupting that energetic connection. And so there will be an imbalance that somehow the body will have to compensate for somewhere. So there's no one size fits all, but you're right, nothing is, whereas in the dental world, we would say, okay, the risks are bone loss to missing a tooth, chewing function, a decrease in chewing ability, having teeth shifting, but most of the people on the stage that I've worked with and Dr. Michael have worked with say that yes, but there's an energetic component to that too, where you can't just remove a tooth with no consequence whatsoever.
Correct. Yes.
Are you done? Can I ask my question? Okay. Hi. So my question is around raw milk. So one of you talked about regular milk that we get at the supermarket, which I agree is horrible. I want to preface my question with I'm not a milk drinker. I don't drink milk. But I have family members that do. And so my grandmother, she drank milk, raw milk, her entire life. She had extremely strong bones, never broke a bone in her life. Mind you, she was 112 when she passed. Extreme, like she just went in her sleep. No issues at all. I got very good genes, blessed with those. So my question is, what's your take on raw milk? And, I mean, she made her butter with her yogurt with raw milk, everything with raw milk. So,
So raw milk is pretty good. No concerns there in terms of calcium being decalcified with the pasteurization process and homogenization processes. So which means you absolutely can absorb calcium from raw milk. The only concern that I actually have with raw milk is you should know the farm from where you're getting it. You should know the cows. You should know the way they actually treat it. You should know how they actually do feed them, what they feed them, all of those kinds of things. Because back in the day, most people actually had cows in their house. So which meant they knew how they were treating it, and the cow was a family member. So it was completely different from when it actually becomes commercial. And so one of the concerns with raw milk that I actually stay away from raw milk is because of bovine leukemia virus. So that's actually a real threat that can be there if it is not something that we are aware of how the cow's health is, that can actually be passed on to a human. And there is a huge risk in children for leukemia. And children, if you look at, any of the statistics for leukemia, children actually have a very high leukemia rates. And so one of the things that is actually contributing to it is, the bovine leukemia virus. So that's the only concern I would have, but if you know where it's coming from and you actually trust it, go for it.
And you need to know the name of the cow.
You need to name the cow. So there is two types of milk too, the A1 and A2 milk. The kinds of genetic changes that has been done to the cows itself, especially in the United States, is what also causes many types of problems with the milk. So A2 milk is actually the traditional cows that come from India. And those cows, the milk actually is very different. The biochemistry itself is very different. And also cow milk is not supposed to be as thick in its fat proportion as it is in most places. And that's what the A1 milk does. The genetic changes that they have made is what actually contributes to the biochemistry of milk in today's world. The A2 milk is very thin, more like human milk. So if you notice human milk, it actually has very thin consistency because the fat composition is low, as well as the protein composition is very low in human milk. It only has more of the sugars. So that's the reason why it's actually very sweet to taste, and babies get addicted to that. The cow's milk, which is similar to that, is actually good for us because biochemically it's very similar to that. But if it's far away from the biochemistry of human milk, then it can cause certain kinds of issues like precocious puberty that we see today, issues with even osteoporosis because the bones are just not getting it from the milk.
and thank you for that answer. That was wonderful. But I also want to extend that to your actual meat, where you're knowing the cows,
Yes.
the farm,
Yes.
and not just the milk, but the actual beef.
Yes.
If you're a meat eater.
Right.
On that same note about milk, because we're talking about cows so much, what about goat's milk? Because it is, my understanding, the closest to human milk.
Yes, it is. Yes, it is.
So
But
is
then
it-
again, it should not be pasteurized.
Okay.
So that's very important. The moment it's pasteurized, because there are certain kinds of enzymes that are present in these foods that makes it possible for us to digest these. Because in our own human body, after the age of 2, we don't really have the ability to digest casein, which is the protein that's in cow's milk, or many different types of milk too. And this we don't have the ability to digest. But if it's raw milk, then it has those enzymes in it that allows us to digest and absorb it. Anytime we don't digest something, it becomes toxic for us. In Ayurveda, that's what we say. Anytime you don't digest something, it is toxic for you. It doesn't matter what it is. It doesn't matter how much nutrient it has. And coming back to what Dr. Michael said, that's also the reason why we do kinesiology. Just because some food is good does not mean it's good for you.
Right.
So the more you know kinesiology, the more you will actually understand that blueberry can be the most beautiful antioxidant-rich food out there, but then it may not be something that you are digesting, which means it's actually poison for you.
Right, okay. So with that, and I understand, removing the dairy, but if you're going to include dairy, if it was something like a raw milk, goat milk or raw goat cheese, would
Yes.
that be the optimal choice?
Probably, again, know the goat. Name the goat.
Yes, yes, exactly.
Because again, anytime we are talking about an animal, the concern is infections, right? Because if they are actually not treated properly, they could actually have infection, because like women have mastitis. The same way animals get mastitis. It's not uncommon at all. And that's also the reason why they pasteurize the milk. The reason why they do it is because milk is mixed. It's not one cow's milk or one goat's milk. But traditionally, because I'm from India and my grandfather and my grandparents actually had cows in their homes. So traditionally, you are never supposed to mix two cows' milks together. You're not supposed to. Because one cow could have a problem and they'll actually keep the milk for a period of time before they actually give it to a baby, and they'll boil it and then give it to the baby. If the milk changes in any ways, they will not actually give it to the baby, because the cow could be having mastitis, which means it has bacteria in it that would make the baby sick. But in our commercial world that we live in, that's not the way it is done. They mix all of the milk together. When they do that, you have no way of knowing how much, which has disease, which doesn't have disease. We have no way of knowing. And that's also the reason why they pasteurize. And I don't know if you know this, they actually measure for how many pus cells are in milk.
Gross.
They do. Yes.
I had another question for, sorry.
I'm sorry.
I had another question for you in regards to hormones and menopause.
Yes.
Would you suggest not doing hormone replacement therapy and replacing it with specific foods that help your own natural production?
If you have your ovaries and uterus, don't replace hormones. There is a reason why it is happening. We need to find out why you're not making enough hormones. We don't need to have the same amount of hormones post-menopause. It's not necessary. The hormones are going to decline because you're not going to have a baby anymore. That is the way it's supposed to be. But if the hormone is declining at a rapid rate, there is a reason for it. And we need to know why that is happening, and we need to fix that. And many times it could be an adrenal issue, not even an ovarian issue. As much as people think immediately it's my ovaries that's not functioning, it could be constant stress that is stressing your adrenals. And adrenals make estrogen, progesterone, and testosterone. So you could actually be having more symptoms from the adrenals than even the ovaries. So taking hormones, it's a double-edged sword. The reason why is even when we are in our fertile years, we don't actually have the same amount of hormone every single day. It changes throughout your cycle. And the same way it is even postmenopausal. They are not exactly the same every single day. But when we take hormones as a replacement, we are actually making it every single day the same amount. And this is where the risks of cancer and things like this arise, because that's not what our body needs. And whatever is excessive that is not metabolized, it's actually going to go sit in organs like our breast and cause breast cancer, which is estrogen dominant.
So we shouldn't actually be comparing our normal hormone levels
Correct.
when we're fertile.
Correct.
Okay, because I
not
think
at
a
all
lot
acceptable.
of gynecologists are doing that. They're saying you're not in.
Correct. And another
right
thing
levels.
also here to mention is even with the bone scan, like most of you who have ever had a bone scan, a DEXA scan done, it's the same exact comparison. T-score that's actually done is in comparison with a 25 to 30-year-old. When you're 50, how could you have the same bone density as a 25 to 30-year-old? The Z-score, which is actually something the Ecolite measures, is in comparison to your own age group. So everything has to obviously be compared to our own age group, not really to somebody that's younger or older. Then we will actually, it'll be comparing apples and oranges.
Right.
Plus, one other important factor is that if you're doing your hormone assessment with blood, it's completely inaccurate.
My question is for you too. I just missed the homeopathic cell salts that you mentioned, 2 of them. Would you repeat those?
Calc fluor, and calc phos. And then again, I will also suggest that not every single person who has osteoporosis or osteopenia needs this. So I always check and muscle test to see what a person needs. What one person needs It's not what the other person needs. Actually, in 2 cases that I presented, the first person never received any salt salts from me. Just so you know, because again, it's so important. And she was the one who asked me that question. She's like, how come? Because her friend referred her to me, and she was taking salt salts. So she asked me, she's taking salt salts. How come I'm not taking salt salts? What's going to happen to my bones? I'm like, get better? Because it's not necessary. I was like, your body doesn't need it. Every single person has such a unique biochemistry. We are all miracles in motion. So it's not a one-size-fits-all at all.
I had a question for Dr. Engram. So I recently just been reading about like a lot of these functional medicine doctors and stuff on Instagram. They're going to get their root canals taken care of. So I just wanted to know, is that something that's even possible? And should everybody who has a root canal be going to take care of their root canals? Especially somebody, I see Dr. Somia, especially somebody who's maybe have like an autoimmune condition. Should everybody be just going to get their root canals taken care of? That was my question. Thank you.
That's a great question. And what I always say, again, is that every person is unique. Every tooth is unique. Every situation is unique. So do I think that we should be closely looking at each and every root canal treated tooth? Yes, absolutely, 100%. I can't say that every person should have invasive treatment done on those root canals necessarily. I also say that a clinically well done root canal to me is still better than an infected tooth with active infection. So that's really important. But yes, when people are, especially people on social media, are getting their root canals taken care of, then it's hard to know how they're getting them taken care of. There are a couple of more open-minded, more holistically minded endodontists or root canal specialists that have some really pretty awesome treatments that can minimize the risk of the procedure itself. And so in some cases, we're having those patients get their root canals taken care of by having the root canal retreated. And in some cases, that's not what we're recommending. We're recommending that they have that entire tooth removed so that we can physically clean out the infection that's left over. So really, it's a case-by-case basis. And sometimes we do none of the above. I have probably people in this room who have root canals that had problems, that had infections that we picked up on a cone beam CT, where we did no invasive treatment, and all we did was treat it with ozone. So we have options. There are lots of options, but I do agree that we should at least be taking a close look at these teeth to make sure that they're not impacting you negatively.
And I'd like to add another quality that Dr. Engram has in her toolbox is that she does practice kinesiology, which is very unique and rare for a dentist. Any other questions?
I would like to know what some of you think about drinking coffee, almond milk, and soy milk.
Great questions. The coffee addict first. I better pass the mic along to somebody else.
So I too am a coffee addict, but I've reduced. Now, from a bone standpoint, the research is showing 2 cups of coffee a day is fine. Right? I would recommend that you choose coffee that's mold-free. There are certain coffees that are higher quality than others. I like the Bulletproof brand, but there are lots of them out there, but it's important on your sourcing on that. The other thing from just a functional standpoint that I like coffee is it raises alertness, right? And as we age, falls are the leading cause of fracture and loss of independence as we age. And if you are alert, you are less likely to fall. So I adore coffee personally.
So I'm going to be the one that everybody's going to stare at hard now. Better me than you. So she passed on the mic, so it's better me than her. So coffee is acidic. Okay, so as Dr. Michael said, so many of our fluids are alkaline. We want to keep our body alkaline as much as possible. Does that mean that you can't drink a cup of coffee at all? Absolutely not. You can. Again, sourcing your coffee is important if you like it, but most coffee is acidic. So there's only one coffee that I know is not acidic and it's alkaline, is RPG coffee, and that one actually has aloe in it. So the aloe makes the coffee alkaline. So if you're going to drink coffee, that's the only coffee I would definitely recommend. But another alternative to that is matcha green tea. So for what we are talking about, the caffeine that you get from coffee that makes you alert, that makes you actually become more energetic and so on and so forth, you can still get that from matcha green tea. But what you also get along with that is no acidity. Second is you also get 120 antioxidants. So which means that I believe that everything that we put in our mouth should actually benefit us in some way rather than take away from us. And the matcha green tea, ceremonial grade specifically, Dough Matcha brand does that. With almond milk, again, whenever you get almond milk or any of the other milks, it's very important to make sure it doesn't have like a million additives in it, lots of sugar in it and all of that. So as long as you take care of that, it's good.
That tastes amazing.
If it doesn't have, again, it has to be the source. I'm not an anti-soy person either, but at the same time, soy can be extremely genetically modified, so you have to be very careful about that and make sure that there are no additives added to it. If it is organic, just soybean and water, filtered water that you can get, then you're okay with drinking a small amount of it. It's not going to cause any health problems.
I want to bring us back to the kinesiology, because you and the person sitting next to you may get a very different answer to these questions. What may be good for one person may be terrible or neutral for the person next to them. So that's why working one-on-one with one of us that can test you and determine what's good for you rather than taking global recommendations.
Thank you, Doctor. Anyone else have a question? We have a few more minutes.
Are you okay with using honey as a sweetener in your coffee?
I don't drink coffee, but yes. Yes, raw local honey is great.
Okay. Like a teaspoon?
Yes.
Maybe.
No, he is the honey drinker, so no, that's not true.
Good to know. And one other thing, what about iodine? I know it's depleted. They took it out of our salt.
Right. Well, it is in the iodized Morton salt, but that isn't really the kind of salt that you really want to consume because it's sodium chloride made in a lab and then iodine added to it. But if you do get iodized sea salt, then you're good to go. But that alone isn't really enough iodine because we do have a lot of depleting factors these days. Chlorine in our water, fluoride in our water, bromide in our cosmetics, shampoos, conditioners, face washes, makeup. A lot of them actually have bromide in them. And on top of it, if that's not enough, we actually have toothpaste, oral rinses. So there's just, and even flowers, they can actually have showers. And then flour has bromide in it as well. Many flowers, back in the day, my mom used to actually grind any kind of grain and bring the flour, but it's no good after a few weeks. It'll start smelling bad or you'll actually have bugs in it and all. And now flour can stay on the shelf for months. So that's because bromide is added to it. Anything that doesn't spoil and stays on the shelf longer have some kind of these things, and they all deplete iodine because they're all the same halide family. The receptors for iodine, they will actually bind to any of the halogens. not just iodine. But iodine is a necessary nutrient for not just the thyroid, but also the ovaries. It's also for the breast. So ovarian cysts, breast cysts, fibrocystic breast changes that we see, all of them have relationship with iodine deficiency.
We have a question here.
So just to add a little bit of something to that, it's really important to have iodine in balance, right? We all think more iodine, but not necessarily. So the oligoscan that we do will actually tell you what your actual iodine levels are. So it's really important to have that tested and then go from there. And then also to understand that it may be an absorption issue. So there are a lot of different factors that can be happening there. So just supplementing the iodine isn't always necessary.
Actually, iodine supplementation should not be done without a health professional helping you, because iodine is a double-edged sword. If you have too much of it, it can cause problems for you. There are certain minerals that you cannot just take on your own. You have to know before you do it. So as Dr. Martha said, oligoscan is a great way of knowing it and then doing it. But removing these things that will deplete iodine is a good start. That way you're not at least depleting, and you can get it from food and source of seaweed and so on and so forth. And those are all not ways of you removing it from your body.
I just had a quick question for Dr. Engram regarding implants. Unfortunately, I had a tooth break off and I had to have an implant. So are you hearing that are people getting metal toxicity from implants, or what? What news do you have on those? Is it good, bad, or what?
More and more frequently, we're seeing that the titanium, that's surgical grade titanium, we're seeing more and more that it has been contaminated. And so we're seeing an increasing number of sensitivities to allergies, to rejection of implants. And so, yes, there are potential problems there, but also ceramic implants are getting better and better in their reliability. For a while, when they first came out, they had a very high fracture rate, and so they were less accepted, less picked up as a treatment protocol by oral surgeons. Now there are at least pockets of them. You know, I have my favorite surgeons that I work with who are very adept, very skilled at these ceramic implants, which tend to be better, tend to be more biocompatible.
We have one more question.
Are the infections showing up right after the procedure, or is it years later? When you talked about
Usually, if we're going to have a reaction to a
It'll be
material, that's fairly soon.
soon, okay. And hip replacements, same?
That I have not replaced a hip yet. My license discourages that, but
it's
what I have heard,
titanium.
word on the street is that yes, that is true.
You said on testing hormones, not to do it by blood. How do you do it? Is that going to be a Dutch test for testing hormones?
The best way to test hormones is to be able to test the higher functioning organs that were mentioned earlier. So the highest functioning organ is the pituitary, and that is never tested. That is only tested via a thermogram. The function of thyroid is also tested via a thermogram. Most hormones are metabolized and manufactured on the hormonal axis, which is going to be adrenal function, which there is really no good medical test for, which is tested for on a thermogram. Same thing for liver function, kidney function, ovarian function. All those things cannot be tested other than functionally through a thermogram. No. Dutch test is extremely expensive, very complicated, and will not give you a specific direction, and it will not tell you the function of any of your organs. You can get those results, but then what caused those results, you won't know. righty. I think this was, excuse me, a beautiful, beautiful day, and I want to thank all of you for being here, and thank all of you for coming. So this is completely recorded and will be available to all that were here. And I'm not sure the process of how that's going to happen yet, but we will figure that out. And so we're excited to share that with you. And if you still want to take advantage of the special that's being offered for today, you can see Pat or Kathy at the check-in desk that was there on your way out. And everyone, we enjoyed it, and thank you very much.